Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. What are the conditions for an RFA procedure to be performed? The first and foremost condition is the fibroids which are to be treated should be symptomatic in nature. What do you mean by symptomatic fibroids? Many people, even though they have fibroids, they might not be experiencing any sort of symptoms. But some people do experience symptoms like prolonged bleeding for more than 7 or 8 days, or a lot of blood coming out in first 5-6 days, lot of clots appearing in the menstruation, severe back pain, pain radiating from the hypogastric region to the back, or pain radiating from the lower back region to the thighs also, sometimes pain radiating from the hypogastric region to the thighs, pain overall in the pelvic region, severe dysmenorrhea during menstruation. All of these are the symptoms of fibroids. Along with this, if you have prolonged bleeding, you can have other symptoms like anemia, that is iron deficiency anemia also. So if you're having any sort of these symptomatology associated with your fibroids, you can get an RFA done. Next is uterine preservation. If you're someone who is thinking of fertility, or if you're someone who's thinking of keeping your uterus, whereas by not removing it through hysterectomy, then RFA might be the chosen procedure. Apart from that, fibroid size and number is very important in RFA treatment. If you're someone whose fibroid is 8 centimeters, 9 centimeters, if it is 10 centimeters, then RFA might not be the procedure for you. The RFA is usually treated where the fibroid size should be 5 centimeters or less than 5 centimeters. And also the number of fibroids should be less than 4 fibroids. So if you're someone who has multiple fibroids, or if you're someone who has a larger fibroid, RFA might not be for you. But if you're someone whose fibroid is 5 centimeters or less, then RFA can be a chosen option. Apart from that, location of the fibroid is also important. If it is intramural fibroid, if it is subserosal fibroid, if it is submucosal fibroid, then RFA procedures can be performed. But it surely depends upon the location, the type of the fibroid, and also if it has a peduncle, that is a stalk or not. If you want to know the types of fibroids, if you want to know the symptoms associated with the fibroids or the causes of fibroids, we've already done a video on it. We will be providing you with the link in the description box. You can once check it out. And there should not be any history of any sort of malignancy. It can be pelvic or cervix malignancy. And apart from that, remember, RFA should be the primary form of treatment that the person is getting. RFA cannot be performed after UAE or after myolysis or after myomectomy. So any prior treatment to the fibroid, then RFA might not be the chosen option next. If you have already done a treatment for fibroid, then RFA might not be the next chosen option. If you're someone who's suffering from fibroids or endometriosis or adenomyosis or polycystic ovaries or dysmenorrhea or PID, remember that Fidicus Homeopathy is the best way to cure all of this. We have two types of consultations here at Fidicus Homeopathy. One is the online option and second is the offline or the in-person option. If you're someone who's staying near the nearest branch of Fidicus, you can come and contact us in person. If you're someone who's seeing this video and are far away from us, you can contact us online through audio consultation options or through video consultation options. Once the procedure is done and once the case is taken, we will be asking you for investigations, and any sort of already done investigations can be shared with us. After the whole procedure is done, especially to our online clients, we will be delivering you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from female reproductive organ diseases, it can be fibroids, endometriosis, adenomyosis, PID, dysmenorrhea, polycystic ovaries, remember that Fidicus Homeopathy is the best way to choose your cure, because Fidicus Homeopathy stands for highest chance of health. Here we surely follow 3 principles. The first one is having highest success rate in already treating the existing disorders related to the female reproductive system. We have good number of cases where the outcome is very good and the recurrence rate has decreased. And also we have transparent treatment principle wherein there is no gray area between the patient and the doctor. We will be discussing it with you about the prognosis of the case. And third is the personal care here at Fidicus is top notch. If you have any sort of misunderstandings or queries related to your problem, they will all be clarified. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.